Well, good morning to everyone. I know this is one of the last morning salutations that you'll get. There's lunch shortly thereafter. So hopefully we keep you well, dazzled, and amazed just enough to hold you off until lunch. My name is Nikki Reihle. My last name is Reihle. See me at the end of this so I can get any new jokes or puns that perhaps I haven't heard in the past 4 decades. I am the Senior Product Manager with Nuvolo for our entire maintenance line.
And I'm Dustin Smith, so I'm a Senior Advisory Solution Consultant with Nuvolo. Prior to coming to Nuvolo a couple of years ago now, I was with Intermountain Healthcare for almost 14 years. In the last role I held there, I was the Director of Central Support with Healthcare Technology Management. So one of the things I want to call out today is how cool it is that we actually have Nikki here. So a lot of groups, they don't necessarily have the opportunity to bring their product manager to get the feedback from individuals like you. If you swing by our booth, if there's anything that frustrates you with Nuvolo, anything you want to see in the future, this is your gal right here. So with that, we'll go ahead and kick it off.
Fantastic. So I do know that we're deviating just a little because how many of you took a look at it and it said a product demo about the connected workplace? Nodding of heads, yes, all. Well, what you didn't know is that you're in for a treat. Because before we get to that, we want to talk about something perhaps a little bit more dear, although I do assure you we will be taking a look at the product. I think what we really want to focus on today, before you get into the product, before you get into the system, is really understanding why. And that's our technician pain points, right? Everything that we do, that's the genesis. That's the end user that bears the brunt of good reporting, of good audits, of your service manager dashboard reports, what your HTM director is going in and fighting on the line for. It all starts with your technician. So we kind of want to flip the script a little bit and talk about those pain points that our technicians are feeling. And Dustin, you actually have a funny story.
Yeah, so, okay, a little bit of my background, right? I started in a kitchen at Intermountain Healthcare. I was actually the equivalent of a fry cook for a big portion of my career. Moved up, then I got a degree in finance. I ended up in finance, then analytics, and I had the opportunity to go back to operations. I'm not an engineer by trade, all right? I've turned a wrench for a full day once. I PM'd some oxygen concentrators. It's about the only thing I can be trusted with, in all fairness. And what happened when I went over to operations is I was leveraging data to understand the health of our shops. And one of the things that became abundantly clear to me fairly quickly as I was cold calling technicians who had never even heard my name is we had stuff getting lost in the system. I called a tech I had never met before in my life simply because he had a work order that was over 60 days old. And first and foremost, the guy was terrified. How in the hell did this random individual get his phone number and is actually asking him about a specific work order that's that old? That kind of freaks people out, right? Because if somebody else has that visibility and is trying to hold you accountable, but you had no idea the thing existed, we've got a problem. And so visibility is so critical to our success. And so with that, seeing is knowing. And then we've got a quote up here from Mario Andretti that really kind of assists with that.
I love it. The whole comment that he made is that seeing, right, this concept of I may not be right behind that car, but I can see them, right? And I can see the benefits. And if there isn't that car in front of me, well, then now I'm by myself and my time reflects it. And when I read this, I'm not necessarily saying that our technicians are race car drivers, but it had a similar sentiment, right? That if I'm doing it by myself, my time is going to reflect it. Technicians are perhaps one of the most collaborative teams. Same could be said about clinical in general, right? It's a clinical sport, it's a clinical team. But why is it that when it comes to documentation, to the system, all of a sudden you feel like you're alone? And then it's man versus machine rather than machine is with me. So today we kind of want to dive in a little bit more into some key themes that our technicians are facing in the industry, right? These pain points apply universally, regardless of what CMMS, IWMS, or any other abbreviation solution that they're using, right? Is that this is universal. So Dustin, kind of talk to us, what's in store for today?
Yeah, so we're definitely going to go over the challenges, and please bear with us. This is our insight. This is the way we feel. These are some of the things that we're really focusing on. And with that, we're going to have solutions that matter. Some of our modern benefits. We are going to ask a couple of almost poll questions at one point during the demonstration. Then we'll go into the demo and then do any Q&A. So again, we want this to be interactive. Once we get into the demo, we're always eager for feedback. And again, that's why it's so awesome that Nikki's here, because that feedback's actually going to be implemented at some point in time.
So that was your warning shot, ladies and gentlemen. If you're here to keep your head down and your notebook open, it's not going to happen. Dustin will find you out. And this is going to be an engaging two-way, which I can definitely tell by some of these faces may not be what you were looking for, but that's okay. We're going to do it anyway. So let's talk about those challenges, right? Again, this is agnostic to a specific tool. This is really about understanding our technicians and taking us back to the basics. And I do promise you, this does tie into technician. But execution, right? First and foremost, getting it out there, doing it right the first time, and doing it right in the system in addition to the actual physical execution of this. How often has it been more taxing to put it in the system than it was to actually conduct, right, the initial PM or the initial work order? Documentation burden, right? That's a big one.
Just having an understanding really of what's required of you. And then one of the big things that comes along with the documentation burden is our coordination. We're not going at this alone, as Nikki alluded to earlier. We've got vendors that we need to coordinate with. We've got facilities maintenance that at times maybe we're standing up an X-ray room. We've also got IT, who plays a critical role in what we do today. And then at the end of the day, you're trying to ensure our clinicians are taken care of. So on top of all of that, then coming back to the documentation burden, when Joint Commission or DNV shows up, do we have everything we need to get through an audit? So there's a lot of moving parts here, and we understand that there are significant challenges within the industry in terms of being able to easily coordinate all of our efforts to execute and then to ultimately create that documentation.
Does anyone else know of any big themes that fall outside of these buckets, that don't trace these buckets at all, in terms of big problems that you're facing or that you're seeing? Seems like this is the genesis. For many. It all ultimately comes back to that. Having problems reporting, well, that's documentation. Having problems with your time to close, well, that's documentation. Having problems with Joint Commission or your audits or getting those reports, well, that's documentation. Having problems knowing where something is so that you can update a clinician or update a vendor, well, that's both coordination and documentation. So let's break it down, right? And again, I promise you guys, there is a light at the end of this rainbow. So for those of you who really only came in for the product demonstration and not about the pain points, I promise you we will get there. But let's talk a little bit about those problems that we see in execution.
Yeah, so we've got kind of these three themes up here, right? So we've got procedure, visibility, and planning. So when it comes to a procedure, how do you ensure you're following either your alternative equipment maintenance plan and your policies around that, or that you're performing what's expected by the OEM? So that's one of those really simple procedures. What are your expectations about closure rates? Joint Commission requires 100% closure. All right, so what does that mean? Is that work order closure or actually performing the work? At the end of the day, I like to think it's work order closure. So, but these are the type of things you need to define. Visibility, having access to what's expected of you, and then even planning, how are we going to coordinate these activities? A great example is if I have a work order come in on CT or MR, most organizations aren't actually performing all of their own CT and MR work. If you're lucky enough to have had the training opportunities, maybe you've got on a first look agreement instead of a full service contract. Either way, somebody needs to own that coordination, and that comes down to a plan. When a work order comes in for a CT, how do I know who's going to perform the work? How do I dispatch that out, whether it's GE, Siemens, what have you? And then how am I going to ensure I'm easily able to collect that FSR at the end of the service? So these are some of the things that we're really trying to hone in on.
Yeah, 'cause it really starts right up front. It's taking that planned approach. And I think visibility, oftentimes, there's kind of two parts to it. Visibility in terms of physically, can I see you as you're running around my hospital? Let me ping you and ask questions, but that derails the technician. Right? Now I'm having to go back in the system and now update that I just spent time talking, right, to provide that visibility. And I think that that's something that a lot of folks struggle with between it. Which leads us to everyone's biggest theme. I guess it's. So what was it? Yeah, there we go. You are alive, just checking. All right, so documentation. I really find that this is really interesting. And Dustin and I had this conversation as time, as he alluded to at the beginning, I'm a senior product manager. My viewpoints and my interests are slightly different. How do I create a product that embraces the best practices of the industry while also allowing each and every hospital to come through and really configure it to a way that's specific for them? Dustin and I have these quandaries all the time, which is he comes from that world. And I'm told time and time again, yes, that is best practice, but, and it's that but, real world, right? A lot of times, yes, this is how we're supposed to do it, but how many times have you find yourself in a pinch and now we're a USPS, if it fits the chips, right? Getting it up and going. So maybe talk about a few of the examples, right? Between that dichotomy of best practice and real world.
So we fight on like a monthly basis. I just want everybody to know that. Yeah, go ahead. Let's hear it.
Wasn't the first one procedure before we have the documentation?
Yeah.
If those could be tied together.
Oh, it's one and the
right?
same. Yeah. Yeah.
So if you've got your procedure built, and you know it's challenging, right?
Yep.
Everything that needs to be done. That's really hard to build those, right?
Oh, yeah.
But then you just take your procedure and you just check off everything you did in the procedure. And that becomes your documentation.
Yep, and that's something that we're actually going to showcase during the product demo, because so we have checklists that really assist in that documentation process to make it that much easier to defend the work that was performed. So we've got, before we get to our kind of real world and best practice, I have two questions, and I just want to take a poll of the audience. So the first question is, and we're going to try and create some buckets here. So if somebody was to estimate your technician's time to document, so after the work has physically been performed, how much later it is to actually finish the paperwork side of it, how many would say the average in your organization is over 15 days? All right. Thank you. Thank you for the honesty, because I mean, that's step number one. Who's between like 10 to 15 days? Okay, cool. Okay, now we've got 5 to 10 days. All right. Everybody else is under 5 days?
How many are over?
Yeah.
15 days. Let's check that. How many are over? No one's auditing anyone. How many are over that 15-day marker?
Depends on the technician.
Absolutely. So
Fair.
you need to have that policy and procedure in place defining it, right? And one of the things to realize that kind of screws all of this up too is when you're working with OEMs. Some of your OEMs get you the documentation within a week. Some of them, in my experience, I had an average of over 21 days with one of the larger heavy metal providers. And I remember when they came in for an executive business review, I literally threw up every other vendor that worked in that modality. And I said, you suck, and here is why. And it's important to be able to have that level of transparency, because this is when Nikki and I start getting into these debates, right? Real world versus best practice. Real world, everybody is slammed. Nobody has adequate FTEs. And we're facing a labor crisis. I mean, how many of the sessions are talking about getting new blood into the industry right now?
There was just 2 yesterday.
Yeah, it's crazy. So we have best practices. Yeah, we go through, we ensure all of our FSRs are in. We've got a time to document under 5 days. Like, these are beautiful, but how in the hell are we going to get there? You know, so one of our consistent debates trying to figure out, how do we make it easier? So the next piece And the next question, who has 100% of their field service reports in the system? Anyone? Okay,
I was gonna say, we were looking for you. We want to shake your hand afterwards. So
and ask how.
So, but that's great to acknowledge. So we're chasing after this goal that, unless one of you is holding out on us, it seems elusive. So now we're doing the best that we can to get as close to. So 90%,
Anyone?
90% FSR. Wow, okay, 50.
Talking external versus
Yeah.
internal?
Yeah. Who's documenting the OEMs and the work that they've performed? 50%. And has the actual field service report in the work order.
I'm 100%.
You're 100%. Really?
Stay after. Bonus points for you. We're gonna ping your brain and ask how you get done. Because part of this, and again, as a product manager, there's two parts, right? As we go through, and we're about to transition over to take a look at the system here, is the difference between what any platform can do for you and how you use it in the real world. Right? That's ultimately what we're gonna talk about. Some of my favorite photos I snuck in, because as a technician, how often do you feel like everyone and your mother is coming after you, right? It just feels like you take a number. You're getting stopped in the hallways, or you're constantly, getting phone calls, trying to follow up with people, and it just feels like somehow you won a popularity contest in the worst of ways, and somehow there's no recognition for it either, right? So kind of talking about those different entities that we serve, and we kind of talked about this earlier, but this is really important because each one of these audience groups don't just represent someone who's picking up the phone. Each one of them has unique needs, right? Different timeframes, different level of detail. And I'm going to one same system, one same entity, or one same notebook, right? To get them their information. But we're ultimately, right, all playing for the same ecosystem, all playing for that same team, and it all comes down to patient support. You either use the things for patient support, you support the software for patient support. Everybody is tied to it, but each one of these is dynamic, and each one of these, presents its own challenges. So we've really talked so far about these big thematic changes, and every single one of you kind of came to terms, reflected in your own, right, regarding the documentation, regarding execution, and regarding the time that it takes to coordinate. All of those are pain points, right? There are solutions. Bigger the problem, bigger the solution. The more dynamic the problem, the more people that you have, right? We have to serve that works for all. That brings in our smart solutions.
Yeah, so when you think about this, okay, we've got our visibility, procedure, and planning was kind of the three buckets that we had before. So having dynamic dashboards that are specific to a technician and having that visibility to what level of contract certain devices are on is really going to be that foundation. Let's understand our work and have that visibility. Then when it comes to kind of our procedure and planning aspect of it, we've got checklists, and that's going to be that defined procedure that you had talked about. Having really, here's what we did, have I actually performed it, and having that recorded directly into the work order so that I have the audit support I need. I'm able to articulate exactly what was performed. And then we've also got alerts, so a simplified recall process that facilitates planning. Who here has Alaris pumps? Okay, cool. So, that bezel recall, what the hell? How many years are we on? Like, it gets to the point, if you were to release all of those work orders at once, you would terrify your technicians. So being able to create a plan before we push out work orders is critical. And that's one of the things that we do immensely well. And then lastly, knowledge. Being able to have policies and procedures stored within the system so we're defining those expectations. If we want technicians, if we want them to be able to understand, hey, we want you to document in under 5 days or at least change a work order state to understand we're waiting for an FSR, we can have a policy that shows up on every work order if we want to.
These are the 4 key pillars, right? Regardless of what, so these are your best vehicles to address those pain points. Now, it's not just having them, and we're going to go through our solution demo now to take a look at how you can really utilize this. It's not just any dashboard. If I have 5,000 assets, and that's on the lighter side, and I've got a dashboard that shows all 5,000, that's not consumable. But I have a dashboard. But if I can't make timely decisions, if I can't sort through the noise, then the dashboard's not working for me. Checklist, exact same thing. If I have a checklist that's 500 questions deep and it's too meticulous, and as a technician, I'm just, pencil whipping at this point, yes, 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 no. Have I actually utilized it? Have I captured what I'm looking for? So spending some more time in each one of these 4 verticals, right? These 4 solutions is what we're really going to talk about today in our connected workplace. And this is, of course, how we, as biased individuals, have chosen to approach that. But part of this dialogue is really understanding, how are you solving it today? So let's take a look at it. I know that's what you guys came here for. I promised it all along. So let's kind of switch gears. As Dustin pulls it up, we're going to dive into the connected workplace. And we're going to take a look at each one of those 4 solutions that we talked at and look through how that ties to the pain points and how we've addressed it. Right? And again, Dustin reminded you all, right? This is a free area meant to engage, right? And we want to hear from you guys. Justin?
Yep.
Take us away.
Let's do it. Okay, so we're starting out on a dashboard, right? And when we think about the data that's going to be meaningful and to help us get through audits and understand the health of our business, it starts with the technician, right? So what I've got in front of us right now is a dynamically filtered dashboard that should be easy to use. So when I think about my day, I want to understand ultimately what's outstanding and I need to focus on right now, what my peers are still focusing on, my PM compliance, and then probably the different work orders I need to complete by type. So this is kind of the foundation, right? This is where I'm going to start that planning process. I also have visibility to my hours worked this week. If people have certain expectations of the productive time put into the system, you need visibility to that. And so that's why I've got this last little area that focuses on that.
Hey, Justin, I really like this bottom area, right? When we talked about the hours work.
Mm-hmm.
How many times am I in an individual work order and it asks me, how long was he in that work order?
So we've
an hour and a half, 2 hours, right? But
Yeah.
I'm not, as a technician, I'm just winging it. But I felt like I was there. But at the end of the week, okay, well, it says that I have now logged 60 hours of work. But HR says, no, you were only here for 40. Well, now I haven't accurately represented what's in there. Do you think my service manager is going to care? More importantly, do you think purchasing is going to care whenever they're looking at, okay, I'm going to reinvest in this, and oh, we've logged that it took 20% longer on this one particular asset type than it did anything else? So providing this visibility, what I'm clicking and doing everywhere else to help provide, right, that informed decision making for my technician.
It's critical, absolutely critical. When we think about our plan, who here thinks about their plan in terms of like a work order type? Probably not a ton of us. A lot of it's going to be, where am I going for the day? And what else can I pick up while I'm there? So instead of grouping by my work order type, I can simply sort this by department. All right, so if I'm going to CP for the day, and in all fairness, I'm a little partial to central processing. I had a team of 5 sterilization guys that were incredible. Within this, I can start looking at my order description and I start making a plan. Even here, I've got a reference number. It sounds like I've called in Steris. So now when that field service report comes, I can simply search for that reference number in the future to actually put in that field service report. I'm helping myself in the future. All right, so I've got an infusion pump, I've got a steam sterilizer inspection, and it looks like I've actually got a chemical sterilizer as well. I've got some sterads in here. So now I'm assembling my kit of what I need to take down to central processing. But as I'm going through this, one of the things I remembered, so this steam leak, I had to call in facilities for that. So I want to be able to shift that work over. When it comes to having a fully connected workplace, which is one of our big focuses, we need to be able to simplify the coordination with others. I talked about having my reference number so I can put in my field service report. What about when I want to push things over to facilities? Well, I can do that. This particular steam leak, one of the issues I'm running into, I think it goes all the way back to the boiler. Like there is excess pressure somewhere and we keep blowing valves. Let's have a conversation. Facilities is maintaining those lines. All I'm looking at is the actual autoclave. So I'm gonna say, can you please check the steam lines leading up to the Century 16?
I think that's a great example. I think another one, particularly right when we're looking at things that come into a service portal, end users aren't responsible for telling you who owns it or who's responsible for fixing it. An end user, right, is responsible for telling you something's not working. So how many times do you get a ticket in and then it becomes, right, the Hunger Games over who owns it? No, it's me. No, it's you. No, it's me. No, and now we're playing table tennis, right? Now it's even more exasperated if you're in different systems. So thankfully for us, right, in the connected workplace, both my facilities and my clinical engineering are all on the same platform. So as we're playing our lovely round of table tennis, the information is going with it. So we can say, hey, an end user, right, accidentally sent it over here, but it's actually for you guys. Or like Dustin said, in the case that, okay, well, I'm able to do up to so much, but I really need, right, facilities to help out. And we can switch those tickets back and forth.
Along those lines too, we all got into healthcare because we believe in assisting clinicians and ensuring they can focus on clinical care. So when they put it in wrong, let's take care of it. We don't want to reach back out to the clinician and say, hey, sorry, that's not our responsibility. It's like you need to call somebody in facilities. Let's have a system that makes it easier for us so clinicians can focus on clinical care.
I'm actually curious on that. So as you kind of brush up on our next item, just to get kind of like a round robin, how many folks here are either were or currently are our shop managers, our service managers, or just the team managers? Ooh, quite a few. And so as we're going through this, obviously our theme of today was from the technician's viewpoint. But obviously, right, the technician wants to group his together, but I bet you as a service manager, if I've only got 5 team members and I've got 500 work orders, ooh, efficiency is that game. So much of what we're showing you here is also applying to your managers as well, that are trying to get the most bang for their buck, right, in terms of optimizing their workforce and saying, okay, our service center, our outpatients on the other side of town. It's on the other side of town, I'm seeing traffic, that's an hour there, an hour back. Okay, well, I only want to go there 2-3 times a week. Let's pull it up, right? So not only because my technician able to make his own decision, but as a service manager, if there's a technician that perhaps needs more help or I want to be more hands-on, I have that visibility to group it as well. And I think that's kind of the theme as we go through. Again, we're showing it from a technician standpoint, but service managers also have a play in it.
I'm sorry, I have a question. So
Yeah.
95 hours that was worked, like labor hours you're showing there?
Nope, it's 8 minutes and 36 seconds. So that count below is kind of my next component I like to talk about. This is our work orders on contract needing to be scheduled.
The other thing was managing the time though, right? The total
Yep.
labor hours.
Yep, and we can see right here. So all of my time has been associated with PMs, and it's 8 minutes and 36 seconds right now.
You're fast.
Yeah, I was kind of curious, maybe you can answer my question later. It's really collecting, capturing that actual amount of time that someone is on a particular work order.
Yeah, that wrench time. That
Right,
time
the wrench
spent.
time.
Yeah.
Because, I mean, that could even be billable, it could be a cost to you, know, so how accurate is that? How you justify your manpower? So I'd be curious to see how your system captures time.
Yeah, and I think in addition to not just your wrench time, right? Because now when we're starting to talk about where my time is spent, well, just because you're not physically, right, manually working on something doesn't mean that you're off task, right? If I'm on the phone, if I'm calling for parts, if I'm, getting training, if I'm attending, an HR meeting, I want to be able to account for that time too. And we have a solution for that as well to encompass folks so that holistically you can now see, right, where their time is spent.
So as a technician, you manually log this, you log in, log off, or is it automatically captured from the device?
From the time standpoint, it depends. So if I am on mobile, right, I'm on the field, click a start, we're off to the races. When I'm done, stop. Okay, how long that time is your. If I'm back in the office, Well, the only way for it to get into the system is someone has to enter it in. So in that part, if I'm going back in, and we'll look at it at full fourth quarter later, but we have the tools to kind of assist that, hey, I was out in the field and I addressed 25 of my pumps, and I spent a total of 5 hours. All right, enter in 5 hours, and I'll distribute it across. But there is a degree of how to get it in there.
Yeah, so on mobile, to kind of take it full circle and just keep it super succinct, on mobile, we have a start and stop timer. So as soon as you scan your tag, there's a little play button at the top. I'm not going to demo mobile today, but once you're done, you hit the stop button and it's going to end your labor time. That's how I ended up with 8 minutes and 36 seconds. Like it's a weird time, okay?
Very specific.
And so being able to capture that super accurately, it's easiest done in mobile, because to kind of walk through our next example, I had the 195 number, which is all of the contracted work orders I haven't scheduled yet. So first thing I'm going to do is reach out to GE, and they tell me Tony the tech's going to show up, and he's going to do that on Friday. So I'm easily documenting this information, and then I'll show you quickly how I can put in my technician time associated with this. So they give me a reference number, ABCD. Again, I'm leaving myself what's necessary to associate that field service report so I can catch up to Greg, because I don't know how anybody does 100%, but he's got it figured out. So with that in mind, I'm going to save this, and then to allocate my time, this is a cost. And so I can very quickly simply put in now, and here's where it starts to get a little fuzzy, which is what we want to avoid. I spent 2 minutes in it, okay? So if I had been performing this work on mobile, which coordinating with a vendor, probably not super effective on mobile, if we're being honest. You're going to do it in your chair likely back at the shop, but that's always going to be the most accurate way to get this time. But here I simply put in, I've got 2 minutes that I spent coordinating with GE, submit it, I'm done. Now I can go back to, again, heading down to CP. I already put together my cart. I understand the parts. I said I'm hitting a chemical sterilizer, and then I'm also hitting some steam sterilizers as well. So we've gone through, this gives us a lot of the foundations we need in terms of visibility and planning. I think the next step is understanding, how do we ensure we're following the appropriate procedures, right? And what other tools does Nuvolo's Connected Workplace offer to make life a little bit easier for technicians? So with that, I'm going to go ahead and talk about our bulk update. There are multiple times where, think about asset onboarding, right? So you have a ton of infusion pumps that show up. So you've got a bill of materials, you put them into the system. Maybe you've got 100 that you're actually onboarding, and you've got 4 or 5 techs doing it. So you want the ability to select multiple work orders and be able to update these in bulk. Right now, I can change my priorities, start filling out my resolution detail and my resolution code, and then having a consistent procedure. These 2 work orders, these are actually physicist checks, but the concept's the same. I can load either that OEM or AEM procedure for any particular model. I can do it at the asset type level, or if I need to carve out specific tags, I can do that accordingly. So when you look at this, right? So I pulled this off of, I think it was the ACR site. This is like a QC check for Mammo. Would this fulfill your expectations of a procedure that your technicians could follow to ensure you're in compliance? Does this kind of jive with that, or what are your thoughts?
I can't really see.
Oh, okay.
But, yeah, I guess there's always room to adjust an alternative plan if we needed to add steps.
Yeah.
Do you have like canned procedures that are already loaded into the system? Change them in order.
So great question. We have an integration with OneSource that we have leveraged with some clients so that they're always relying on a third party to provide the manual that they can leverage to ensure they're following the appropriate procedure. As Nuvolo though, we provide the infrastructure, you provide the data. However, if you make friends with other people on Nuvolo, you could always export XML and share checklists. It's a matter of
We
Yeah.
actually get that quite
Sharing.
often.
Well, yeah, who wants to build something that's already been built, especially something
Right.
so time consuming.
yeah, no, absolutely.
Talking about time consuming, just a rough gut check. How much time would you say your technicians on average, right, spend on documentation in a week? Exactly, so but rough, say, take your best one, take your gold star, the one that you tell everybody, you tell HR, find his resume and find me more of that one. How long does it take him? Or her?
Well, you,
In a week.
the one in the middle that you want, but you
Yeah.
got the extreme.
Sure.
I fixed it. Yes, I mean, 5 or 6 minutes at most to get through a work.
Okay, and how many work orders does he cover in a week?
Well, PMs are a little easier to close, but a repair work takes a little longer. He could have 300 PM work orders a month, so
Mhm.
divide that per week. Say 400, that'd be 100 a week that would be closed as a PM.
That's almost 8 hours.
But they're
Multiplying
more-
out
they're more
plus or
simple.
minus,
It's a lot easier to close a PM work. Well, no,
Oh,
it's
for
not-
sure.
Not if you're using, you have to go through and fill out the pass fail check.
But it's still a significant portion of
It
time,
takes a lot of
even,
time.
at your gold star that's flying through. So around 8 hours plus or minus a week. Anyone else? Up or down? Average, how much your technicians are spending a week in documentation?
I'd say 5%. I mean, depending on the technician, the type of work.
That's a lot.
Yeah.
So being able to do what Dustin just said, right? This is my full checklist. So here, instead of having to click, how many questions we got? 10?
13.
13. So 13 times 100. That's my infusion costs I'm running around at that time of the month. Right? How much time do you think I'm able to save just by being able to say, okay, I have my 100 infusion calls. Only 10 of them were actually found defunct. So let's put them to the side. The other 90, I just saved how many clicks? And more than clicks, it's time. It's not just about click. I'll click all day long if it's meaningful. If it means I can do less work later on, click away, let's go. But it's about time, the time that's saved. And more importantly, give me more time to spend on the exception to the rule. I could probably get better documentation if I only had to really focus in on the 10, right, that we had problems with. If I was able to fly through the other 90. So this is not only going to give you back time for your technicians to be able to do it in full, right? All of my checklist items, be able to toss it over to so-and-so for them. But now I can also, I have the time to improve, right? Where I need to spend time adding my comments.
What's up?
I have issue with this because you have major quality control issues.
I'm glad that you brought that up.
And
Oh, and I'm ready for
I've
it.
seen people click through, or just click all, pass all,
Mhm.
it makes me nervous because they didn't go through every single step.
I like that. So, and
Built up like pilot to do this.
so, and that's your, and if I'm not mistaken, right, I think I saw also both of your hands go up from that service manager role, right? This system has to serve both audiences, actually more than that. And then we're back to that best practice versus reality. And I think that as a product manager, we want to build in checks and balances that make sure, one, as a service manager, you're able to turn this off and on. Do you want your technicians to have it? Yeah or nay, first off. But second of all, that if you do say, yes, my technicians, if I trust them to work on a life-saving device, I really hope I can trust them to put it in the system, right? So if I have checks and balances out of the product itself that say, hey, it's got to be the same asset type, you can't be going back and forth. Has to be, right, the same checklist so that I'm not accidentally updating checklists that aren't there. Oh, and by the way, notice the question types. Anything that's specific to that asset, a meter reading, it's not there. to make sure that they're going in and not just typing, oh, meter reading was 100. No, go type it in. But my guest knows that I'm visually going through. I can flag through. So it's a balance.
Do you put values in this, in your system as well?
Nope.
Like you have like a range on a checklist?
You can.
Yeah,
but
you
not
can on a
people.
checklist, not on bulk,
Okay.
because that'd
Exactly.
defeat the point, you know?
So that's one of the greatest discussions, and welcome to Dustin and I's talk show, which is real world best practice. What a technician wants isn't always what your service manager needs out of them. And so getting a system, again, system's only part of the play. System's what you use, how you use it, the procedures that you have in your organization, or even within your team, right? There's multiple service managers, we kind of do things a little differently, is the other part of the story that's not represented. And so connected workplace is meant to be configured by each client to allow for what's there, right? What you are comfortable with. Sorry, Justin, I took it away from you.
Oh, no, you're good.
Can I ask one more question on that? Because that's a very interesting method of doing that. Most systems will not let you close because of the quality of that. But I guess my question is, as a technician, how am I tracking which pumps I touched, right? So is there like a tracking mechanism that I'm going through and I'm putting a check mark next to it in here or whatever so that at the end I can do those checks? Or, I mean, because that again would be the concern. Did I actually touch all of those pumps? Instead of managing to the exception, you also have to make sure that everything did get touched.
Yeah. So great question. And this kind of goes to Nikki and I were having a debate last night. Discussion, sorry. So thinking about real-time documentation, bulk can be dangerous, right? Because so you can actually unintentionally end up encouraging your time to document actually getting worse, right? Because some techs may wait until Friday. And this was our debate last night. And I asked the exact question you did. How am I going to ultimately identify exactly which devices I touched? So for me personally, infusion pumps, I mean, a good tech can basically PM 4 at a time, a good portion of the time. So if we think about it, it's normally 20 minutes. We'll give them 30. So we're going to say, shit, how many are we doing in a day? We'll say like 20 something, you know? So what I would do then is I would likely understand what location those came from. And I'm going to start establishing a particular filter to make my list smaller. And those are going to be the pumps I select at the end of the day. So I would coach my technicians, hey, give yourself 20 minutes at the end of the day to bulk close your 20 work orders, and you need to make sure you filter accordingly. Because quality control can be a concern with bulk work order closures, but it's also a huge concern with every damn work order at the end of the day. Some of your techs are amazing with documentation. Some go too far, to your point. Like a resolution detail that is 2 paragraphs, you should be a novelist, you know? Like we don't necessarily need all of that. Yes, sir.
I'd like to take a step back just for a second. Bulk closure, these work order items, is this part of connected workplace, or is this part of Nuvolo, the base package?
Yeah, this is part of the base package.
This is part of the base package.
Yes, sir.
Does this bulk closure have anything to do with connected workplace?
I want to interject.
So like, I'm a little confused.
Okay.
The reason I came to this product demo was because I thought connected workplace was the ability to work across different service lines, and I wanted to see a demonstration. Now, I heard you mention, oh, you can pass it to facility, you know, so that's kind of like, this is like basic and 101 to me.
Yep.
How anybody, you know, different people manage it different ways and all that. So I'm just a little confused on the workflow here. If you could just help me out just a little bit.
Yeah.
Before you jump in on the workflow, and I do want to be cognizant of time. So kind of 2 things that, again, as a product manager, I'm real keen on words. And I want to be clear that what we introduced, which the reason why, I don't know if you noticed the UI looks, well, better, is that it's brand new, 1. And 2, what we showed was being able to answer my checklist and my non-range questions. We're not bulk closing, which is different. To close it, I still need to go in and individually go through, but there's still a significant amount of time that can be saved by doing my checklist. So not to be a stickler, but that was here and there. And so then Dustin, from your standpoint, to answer the gentleman's question regarding the connected workplace.
Yeah, so we deviated a bit from the title, if I'm being completely
Oh, okay.
honest. Because we've done several connected workplace demos, and we have real estate and lease, we have space. Yeah.
It's just like specifically, I was looking more forward towards like asset management,
Mhm.
how that ties between engineering, IT, facilities. So, yeah, I was just getting confused. I was
Yep,
like,
yep.
"Hey,
Yeah.
My bad.
No, sorry about that. Yes, sir.
Easy question in this side. We've got our IT division is at service now.
Yep.
We're in Nuvolo, and the problem is right now that we're blind to each other.
Yes.
And that's one of the issues we get when I work with my PACS team,
Mhm.
which I'm in medical imaging. We're trying to figure out how, if a case comes into them in service now, I'm blind. If it comes in through our dispatch, we've created a Nuvolo work order on it. But to try to mash those two together, because the one lives out in the ServiceNow platform, ours is living in Nuvolo.
Well, it's a visibility play.
Yeah.
Yeah.
I don't want to collude it with mine. I don't want my technicians accidentally picking up things that aren't theirs, but to have that visibility of what's going
Well,
on.
the catch would be is like, if you're doing a resolution, like let's say somebody, I can't send my image to, whatever the repository is. And we ID it from our standpoint, it would come through as like, let's say a CT scanner. We would put it in, and right now what we have to do is we deem it on the IT side. What we'll do is we'll call in the service work order to the ServiceNow team and say, okay, you've got this one, here's where we're trying. But to try to map, like we may put a reference to the incident report, but we don't have anything that can come back in and say, okay, here's what we did. And
Yeah, that
it just sits
history.
there like that, and then out of their end, they may have resolved it, they may not have resolved it, and it's, that connecting those two worlds, has been a little frustration between our two groups.
So the coordination between, like, we already talked about vendor coordination, right? The coordination with IT, and this is something that is talked about and discussed, or it needs to be as a part of every implementation. You can assign a task to IT, and IT could assign a task to you, but it needs, the reports and dashboards need to be set up accordingly so those groups have visibility to it. And it's one of those things, because we live in the ServiceNow environment where IT lives and plays, and we have the areas that we focus on. So it's one of those things that it's a discussion that needs to be had.
Yeah, because I can see the dashboard standpoint, but when you get into like the nuts and bolts work order.
Yep.
Like where I may come back in, get called back into it and say, okay, it's dispatched to you, you dispatched it to them.
Yep.
And what have they done? And at that point, we're completely blind. We may have an incident report. We can't even report the incident.
Yeah, because they're two separate tickets and they're not combined.
That's
Yep.
the point. Where we just had the reference.
Yeah.
Or even if you put them both together and said, okay, these two tickets are married together.
And what's really interesting is, and I know we need to switch gears because we have about 12 minutes left. But that comes down to when we talked about earlier, right? Each hospital is different, and we've gone through implementations, right? And some IT departments have come in quite strong for unknown reasons and said, no, there's some sensitive information. We don't want to have, technicians having access to this. And so finding, again, that balance, right? There are ways through dashboards or through history reports to be able to see, hey, I just want to understand, right? What was worked on, what is this and this in that connected workplace. But it's also interesting for us because we have this conversation with others and there doesn't seem to be one singular answer or one singular need. And that it's interesting that, I guess, within the industry between us and IT and fairness facilities as well, right? What needs to be shared across?
My opinion would be is if you're working on a chiller on my MRI in your facilities, I should have full visibility to everything you did in my chiller.
Yeah.
If you're, doesn't matter what the fence is, if it's by that tag number, I should have full visibility of all the way around it.
Mhm.
You can have it.
And it's setting up, it's setting up a relationship.
So kind of switching gears and kind of wrapping up and talking about some other areas of visibility, right? And being able to plan, talking about our procedures. Now we're kind of looking at it as a service manager. So before, right, we're looking at it as a technician, really diving into what they see, how they can address their pain points. And here Dustin's pulled up our new plan maintenance schedule view, right? Which is more so for your service managers or your shop managers, for them to be able to see in advance. That's not what your transition to.
Yeah, and this ultimately alludes to visibility, right? Being able to understand what your technician's workload is looking like, being able to filter this based on different information so I could see specific groups. I realize this is a little light, but it creates the foundation, that understanding of what could be. And then when we think about, we had talked about checklists earlier and how all of that ties back, we've created a new framework for setting up our PMs that's very simple to go through and understand, am I doing this at a model level? Am I doing it at an asset type level? And being able to select those and then have nested PMs. So a great example, a lot of the equipment is going to have possibly a quarterly, semi-annual, and annual checklist. And when the annual checklist is due, you only want to see the annual. And so we have that capability now within Nuvolo.
Can you change like the schedule based off the department as well?
Yep, we can do it. So we have the opportunity to delineate based on space. A great example where this happens is sometimes your ACR accreditation needs are a little bit greater than maybe what's in a regular facility. So you can absolutely do, in that case, like certain radiology devices are going to be on a 6 month if they're out in these locations, and then they're on an annual for these other locations. Within that, you're also able to define within the frequencies what checklists are available, and then also level of efforts. So you can start really understanding how are we performing relative to our expectations, and even associating certain documents that would kick out as part of that PM. And with that, we've got 8 minutes left. Do want to kind of open it up, see probably in the next 3 to 7 minutes. Are there any specific questions anybody would like to cover?
Talk about asset management.
Uh-huh.
Like, how do you load?
Like bulk loads or
Not any, like, not bulk loads.
just a new device?
Yeah. I guess I haven't seen your system before, so.
Yeah.
Here's an asset management, obviously your first step, maintenance.
Yep. So you can go ahead and you simply set up a device. A lot of information is going to roll back from the model. So we leverage a specific hierarchy. You've got an asset type, then a model and a tag. And there's certain subsequent information that's going to be derived from all of that. So if I put in, for instance, a Steris, I'm only going to be able to select any of our Steris devices. So here I go ahead and put in a Century 16. It's already loaded by asset type as a byproduct of that is tied into the model. We're going to go ahead and say where it's at and give it a tag number. And that's step 1, right?
Quick question, do you have a library that does all that for you?
A library?
What I'm saying is for instance, yeah, you just typed in Steris, right?
Mhm.
And you had all the models.
Yep.
Does your system like automatically upload based off of, where do you get that information from?
Yep.
Like
So
free, or how does that all tie in?
we do have an ECRI integration that's out of the box. It's to create more or less aliases so you can perform your own data cleansing, but our library is ultimately coming from your previous system. So as part of an implementation, there's that data
So
import.
the use case that he's showing is, right, if you're a brand new client, you're not going through this, right? You're bulk uploading, that's a completely different one. What this is that I'm replacing one, or I just got, one brand new one, so now I need to add that. Well, the rest of your inventory is already in the system. So it's automatically gonna say, oh, are you trying to add something that you already have? We can, rinse, repeat, and get this faster for you. Yes, on the side.
If we already have the system, we want to go to this system, you guys transfer all the information over.
Mhm.
Okay. so-
Yep.
And then.
Yeah, and one of,
No, we just give you a pen and paper and a carrot pen and wish you good luck.
Because we know it, because in the past, we've had an older system and we went to your system.
Yep.
And when they transferred over, literally, we didn't get it.
really, yeah,
Names.
that's interesting. Yeah,
Yeah, but it's been a while.
Yeah.
since that happened.
No, it is a big process though, right? Because for some, if you've got hundreds of thousands of lines,
Yes.
right? And so we have an entire department that's there to support you to make sure that once you're up and running, right, that everything has safely transitioned over. There was another question on this side.
Yeah, I have a question about your bulk closing.
yep,
So when you click on bulk closing, and I guess more representing PMs,
yep,
click on it, it brings up the model of a particular piece of equipment. You're saying if we go through the filter and break that model down, because you haven't done, to say at the end of the day, you're gonna sit at your desk, close out your work order. But you went through and done X amount.
Yep.
You can go through and you filter, separate just the amount that you did rather than selecting that model and closing out all of them, which
Yes.
is not done.
yes, sir. And that was the question that
Right.
was alluded to with the infusion pump. So as the biggest thing is, and what's important regardless of what system you're on, have a strategy and like know the system well enough to be able to think conceptually about what you want to do. The challenge with, if you've got 1,000 infusion pumps, the challenge will always be, how do I break those out? And for me, instinctually, where my mind goes is, if I'm trying to go unit by unit and our last location is relatively decent, I'm probably going to try and do a floor at a time. You're laughing because the location is rough. Yeah, so, and again, it's reality versus best practice, right?
And I'm asking because you've actually, you used this.
Yep, yep,
So I've experienced that issue.
yeah,
So where I'm trying to bulk close, pulled up a model,
yeah.
but I try to separate out the particular ones that we've done.
And you're having a tough time finding that perfect filter. Yeah, let's talk about it offline. Yeah, because I'd love to sit there and better understand kind of where you're at, and I'm sure we can come off with a solution.
I'm gonna eavesdrop on it. Well, but here's the thing, right? So much, we've really addressed it from a technician's, standpoint in terms of keeping it up to date, right? But it's not any good for us or for anyone if the system is so difficult to understand. If it takes such a high level of mastery, I can teach you all the tools of the trade. I can get you, a ServiceNow admin course, but that's not repeatable, right? Your technicians, this is not their primary job. This is a part of their job. So as we go through, right, some of the newer UIs that you saw for planned maintenance and for full work order, you'll notice look nothing like ServiceNow. It's for a reason. ServiceNow is great at forms and field capture, but less so, right, on requiring that end user to have high mastery. So understanding how to use the tools is a big part of Nuvolo moving forward. And one of our commitments is to these new UIs that we're using to help make sure that, look, it doesn't matter how great the tool is. If I can't use it, I can't do it, right? And so that's a part of the conversation as well. 2 minutes. Who's got the last good question?
I just went through a joint commission inspection. The inspector asked me to bring the inventory of all the devices.
Yep.
And I gave it to him. He came back and he said, show me the ones, of course, I was using filters.
Yep.
The ones you have an AM and OEM, and the frequency on that sheet. I
Yep.
couldn't find out to get frequency. How do you get frequency? In
In a list view.
Yeah, in your
you can pull
reports.
over. He wanted to see the, and they provided the things as you provide them. I went through and showed him how we did these machines quarterly, semi-annual, and annually. But I couldn't say it had a 3/6 work.
Yep.
Is that somewhere in ability, or do you have that, or is it somewhere?
Yeah.
It was a weird question, and I had to work around, get him to understand. I didn't have it.
Yeah.
And I can't show it to you in simplistic form on
Yep. So I could tell you right now, it'd be on 2 reports right now. And I could pull it into one, but it's going to take me 3 minutes. But it goes back to exactly what Nikki said. Like I am the equivalent of a ServiceNow admin. I live and breathe in this system all day, every day. And it's not reasonable to expect everyone in the room to have the same level of expertise that I do. This is my job. You know, and that's why Nikki's here, because, and I'm sure her ears are like, she heard you, man.
So the short answer is, yes, you can do it.
Absolutely.
The short answer is, yes, you can do it, but it takes a while. I'm so sorry, I do need to be mindful of time.
Multiple times, every day, every week, for every inspection.
Yeah.
Yeah.
So hang back for some more chat. But thank you guys all for attending. That is time, and I want to be mindful of lunch, which is very important. Thank you guys for stopping in. If there's more questions that you have, please feel free to stay back and have a chat.